Hi and welcome to this Wound Hygiene Bite-sized podcast. My name's Shelley Hawkins, Strategic Customer Engagement Manager at Convatec. During this bite-sized series, we'll be introducing you to Wound Hygiene, a 4-step protocol of care that anyone can do. For this episode, we're joined by Jay Hughes. Jay, would you like to introduce yourself?
Certainly, yeah. My name's Jennifer Hughes, but most people know me as Jay. And I started my career straight into the community setting from qualifying. And I must admit, I took an instant dislike to wounds. I think just seeing how my patients under my care suffered and life-limiting. So that made me become very passionate very quickly about, the care plans and those wound products that I could see that made such a difference very quickly to get these wounds to heal. And I think that passion then led me to become the tissue viability link nurse for the community setting I was in at the time, which eventually led on to a position within the tissue viability service, and then eventually led on to me taking the lead nurse position, which is where I am now.
And there came a point in time when you became aware of a real prevalence of hard to heal wounds in your area. Can you tell us about that?
Yeah, certainly. It was during the step back up process, post-pandemic. We'd noticed a massive increase in referrals into the service, and it went beyond our ability to cope. If I'm honest, we started to breach key performance indicators. And we also noticed a shift in the nature of the referrals that were being sent to us, in that we were being asked to provide sort of general wound care advice rather than the specialist advice that we are commissioned for. So we decided to do an audit to try and figure out where these changes had come from and try and find ways to meet these challenges. So we focused our audit on 3 of the highest referral bases in the area that I cover. And the audit very quickly showed that the patients with wounds in these 3 care settings, their wounds were either 65% static or deteriorating. And that was really disappointing news for us. So we decided to drill down further, and we realised that high percentage of really experienced nurses that we had pre-pandemic, they'd either been promoted into non-patient facing roles or they'd left the NHS, and they've been then replaced with a high percentage of either newly qualified nurses or nurses who didn't have much experience with wounds. So we knew we needed a straightforward pathway. We knew that's where our that's how we're going to meet our challenges, by coming up with a simple wound hygiene pathway to help those 65% of static or deteriorating wounds.
So how did you hear about Wound Hygiene? And obviously it appealed to you because it met those goals of being a simple 4-step protocol. But how did you hear about Wound Hygiene?
It was our industry colleagues. I'll be honest with you, I was having a bit of a moan about the challenges and about our intentions to look around to see what pathways are already out there and that have been proven, because we needed something quick. So our industry colleagues showed us the Journal of Wound Care consensus document that had the wound hygiene challenge in it. And as you said, because it's such a straightforward pathway that did tick all our boxes, we needed something simple and doable and something that could be rolled out within all the different care settings that we cover.
Fantastic. So how did it go when you rolled out Wound Hygiene? What were your results?
Really good results. So what we did is we invited 10 patients with hard to heal lower limb wounds to take part in a 12-week wound hygiene challenge. During those 12 weeks, we lost 2 participants along the way, but that was from non-wound related reasons. So out of the 8 participants that lasted the course for the 12 weeks. I'm really pleased to say that 4 of those patients healed within
Fantastic.
the first 8 weeks.
Amazing results.
And then the remaining 4 patients, by the end of the pilot period at week 12, their wounds had a 50% or more reduction in size. So these last remaining 4 patients were well on the way to healing. And the reason why we were really made up of that was because these patients had their wounds between 6 months and 2 years duration. So we realised we were onto something with this pathway.
That's amazing. Fantastic results. So now you've been doing wound hygiene for a number of years in your area. What's the adoption like across the region, and what kind of results are you seeing?
Well, it is standard practice now. embedded the wound hygiene pathway into our patient's wound assessment template within the patient record. We've also allocated a slot to cover the 4 steps of the wound hygiene pathway within our mandatory training for our nurses who come to our training every 3 years. We've then gone further to offer the support from our industry colleagues to put on annual wound hygiene events, which so far have been really well attended. And within these events, healthcare professionals from all care settings are invited. They've been attended. And that's got the intrigue of some of our acute sector colleagues. So actually our acute hospital, they're about to roll the pathway out themselves across all of their different wards. So I'm now in the position, because some of the other colleagues in my team, some of the tissue viability nurses in my team have reduced their hours. I'm now in the position of being able to use those hours to recruit a wound hygiene nurse. And we're about to go out and visit all of the nursing homes with these good results that we've been having.
That's really incredible that it's had such an amazing influence across the way all of your nurses practice in the region. Yeah. So Jay, have you seen any challenges when rolling out the protocol?
Well, there are always challenges when you're trying to introduce something new. But the biggest 2 big challenges that we face was time, essentially. This is a call to action. We're asking our nurses not just to go in and pop the dressing on and leg it off to the other 17 patients that they've got on their list today, which is understandable. But what we've managed to convince some of our teams to do is just focus on those patients that take up a lot of their time, the patients with complex needs, hard to heal wounds, and just embed the 4 steps into every single dressing change and just see it making a difference. So rather than trying to tackle your whole entire caseload, just focus on a few where you know you're going to see some differences. So that's been one challenge that we've helped to overcome. There was another challenge in that some of our nurses believe that you can only really apply silver for 2 weeks. And one of our dressings that we use as part of the wound hygiene pathway is an anti-biofilm silver product. So we've had to overcome the myth that this has to be taken off after 2 weeks. And that is a common misconception. So we're trying to clearly explain that if there are signs of improvement or even, leading up to signs of healing, that's your rationale to carry on with your care plan. But we would encourage you to carry on doing your wound assessments every 2 weeks,
yes,
because
of course.
You should carry on seeing that progression. And if you're not seeing progression, at that point, you change your primary dressing.
Yeah, and hopefully the data we're now seeing from the NICE LSA will back up that decision-making process. Thank you very much to Jay for joining us. For the next episode, we'll be joined by another tissue viability nurse. So we'll see you then.